Welcome to today's lecture, and it's going to be the last part on section B. And for today, we'll be discussing the patient charter. My name is Pam Mark Bequin from Fexens Health College. Now, universal access to healthcare without discrimination is a basic human right. Every human being has gotten the right to healthcare. The patient charter, if you want to define it, is an official document by the government or an organization that enlists various patients' rights and responsibility, along with a code of practice followed by a medical personnel. Now, we've done the laws of pharmacy and we saw what the law said. In fact, the main function or object of the Pharmacy Council, if you still remember, is to secure in the public interest the highest standards in the practice of pharmacy. When we learned about these practice standards of the medicine counter assistant, we saw that everything about ethics has to do with our behavior towards the patient. The patient charter summarizes everything that we've learned so far. The Ghana Health Service expects healthcare institutions, whether it's a pharmacy or a hospital or a laboratory, to adapt the patient charter to ensure that service personnel as well as patients or clients and their families understand their rights and their responsibilities. This charter is made to protect the rights of the patient in the Ghana Health Service. It addresses key issues as follows. One, the rights of the individual to an easily accessible, equitable, and comprehensive healthcare of the highest quality within the resources of the country. Now, this is very important for us to understand. The word is easily accessible. Healthcare should not be far from a patient seeking health. So wherever the patient is, there should be healthcare facilities to be able to help the patient, okay, to be able to get help. It should be equitable. We should not have all hospitals and clinics and pharmacies in one community, and in the other community there will be nothing there. And that is why the Pharmacy Council, as part of their functions, ensures that there is an equitable distribution of pharmacy throughout Ghana. All right. So when a pharmacy is opened and somebody wants to open, they ask you to go to another place so that we make sure that the services is equitable and also should be comprehensive. Two, respect for the patient as an individual with the right of choice in the decision of his or her healthcare plans. And as I've said earlier, when we did ethics, we talked about autonomy. In the patient charter, we respect the patient's right of choice in any decision that we want to make about their healthcare. Three, the right to protection from discrimination based on culture, ethnicity, language, religion, gender, age, and type of illnesses or disability. With this COVID-19, we've even seen that some patients are discriminated in the community because of their illness or a disability. As a healthcare professional, we are not supposed to discriminate among our patients. And the last one, the responsibility of the patient or client for personal and communal health through preventive, promotive, and simple curative strategies. That in the health charter too, the patient has gotten a duty, a responsibility to ensure that whatever health condition they are, if it is communicable like the COVID, okay, the patient covers their nose, they stay indoors and isolate themselves so that they don't spread the disease among other people. All right, so these are the four main key issues that the health charter we are about to discuss is going to address. Now, without wasting much time, let's go straight to the rights of the patient. Now, when it says somebody has gotten a right, it's more like a privilege. Okay, the person has gotten a privilege of health service delivery. And the first one is that the patient has a right to basic health care. The patient has a right to quality basic health care, irrespective of his or her geographical location. It's rather sad that in a lot of countries, including our country, Ghana, that most of the very good health facilities are located in the district capitals and maybe in Accra, Kumasi, Takrade, and Tamale, and maybe Ho. All right. So those in the villages normally don't have access to quality basic health care. Okay, but that is their right. Wherever the patient is in a village, they should have the right of quality basic health care. It's rather unfortunate that a lot of patients that are not living in the urban cities don't have access to health care. In a lot of us, let's ask ourselves this question: in our villages, how many pharmacies do we have even in our villages? Okay, most of the very good pharmacies we have is in the regional capitals and sometimes the district capitals. Even chemical shop may not be in the villages. So the first right of a patient, that the patient has gotten the right to quality basic health care, irrespective of his or geographical location. Two, the patient is entitled to full information on his or her condition and management and the possible risks involved, except, please, it's not expect, sorry, except, okay, except in emergency situations when the patient is unable to make a decision and the need for treatment is urgent. Now, what this means simply is that anytime you go to the hospital, anytime you want to treat a patient in our pharmacy, before we start to manage any condition, the patient should get full information about the condition and how we will manage it. And if there's any possible risks involved, the side effects of the medicine, if it's a surgery, what are the risks involved? Would they be able to walk again? Would they have a normal life? Everything about the surgery should be explained to the patient. The exception is only when it's an emergency and we have to make a decision. Okay, so in the best interest of the patient, we will act. Okay, so we only override by not asking the patient and giving the information when it's only in an emergency. So it is very important for us to understand this. Number three, the patient is entitled to know of alternative treatment or treatments and other healthcare providers within the service if these may contribute to improved outcomes. Now, when a patient comes to the pharmacy or goes to a hospital and we want to treat, we give them all treatments available. For example, if a patient comes to my pharmacy with common cold, even though that we may want to sell the common cold medicines, we let them know that they should eat fruits and vegetables, they can inhale warm water, they can stay and rest more so that they'll recover. If there's any other treatment that we think the patient can benefit from, the patient is referred to. Number four, the patient has the right to know the identity of all his or her caregivers and other persons who may handle him or her, including students, trainees, and ancillary or auxiliary workers. So that is why in working, we are supposed to have a name tag, and the name tag will have your name and your job description. So as a pharmacist, I'll have my name tag, Pharm McBequin, and my job description will be there, pharmacist. If it's a nurse, the name of the nurse will be there, and their job description will come. So that the patient should be able to know when something goes wrong. Anytime a patient comes, it is their right to know the name of the healthcare personnel and anybody that will handle them, including those who are helping. We call them the ancillary or auxiliary workers. Okay, like those who are the caterers bringing food to the patient, those who are cleaners who are come to clean the walls and all those things. The patient has the right to do their name. The next one, number five, the patient has the right to consent or decline to participate in a proposed research study involving him or her after a full explanation has been given. The patient may withdraw at any stage of the research project. A patient who declines to participate in or withdraws from a research project is entitled to the most effective care available. Now, I decided to talk about the five and six together because they are linked. Now, assuming, for example, this COVID we are talking about, there are trials and vaccines that governments want to try, and somebody with COVID decides that, okay, I want to try. Now, if the patient decides that they want to try, after full explanation of the risks involved has been given to the patient can decide the following day that I am no more doing the trials. I don't want to use myself for it again. Now, in the case where the patient withdraws from such trial, from such research, we cannot say that if the patient is sick, we will not treat them again because they withdrew. And that's what point number six is talking about. So even when the patient withdraws, it is their right for us to still give them the most effective care that is available. All right, and that is very important. Number 7, the patient has the right to privacy during consultation, examination, and treatment. In cases where it is necessary to use the patient or his or her case notes for teaching and conferences, the consent of the patient must be sought. Now, what this means is that during consultation in a ward, okay, in a consulting room at the nurses, when a patient is talking about their personal issue, what is wrong with them, the third party should not hear, and that's what we call privacy. If somebody else hears, like the picture you can see there are two ladies there and the nurse is writing. The second one, unless of course the one in question is not able to speak or does not have capacity, but you cannot go to the hospital with your friend that your friend is going to see you off or going to accompany you to the medical doctor's consulting room. No, it's not allowed. During consultation, we don't allow any other person to listen to the conversation between us and the patient. For example, if such a conversation leaks outside, the patient will always doubt the credibility of the healthcare personnel. So it's the patient's right that when they come to a consulting room and there's somebody also in the consulting room, they can ask the healthcare professional to ask the other person, the third person, to excuse them because she has gotten the right of privacy. Number 8, the patient is entitled to confidentiality of information obtained about him or her, and such information shall not be disclosed to a third party without his or her consent, or the person entitled to act on his or her behalf, except where such information is required by law or is in the public interest. So we've talked about privacy, we are adding about confidentiality. In whatever the patient tells us, their information, their folders, the lab results they've done, everything about the patient should remain secret. We don't tell the third party unless, of course, it is in the interest of the public or we have been mandated by law. It's a court case and we have been asked to come and be a witness. That is when we break the promise of confidentiality. Now, before we come to number 9, let me say something about privacy and confidentiality. Normally, patients that come to our pharmacy, please let's assure them of confidentiality. Tell the patient that, Madam, say, boss, whatever you are telling me here remains between the two of us. If the patient is assured of confidentiality and we provide privacy, the patient is going to tell us something interesting that can help us to make the best decision in their treatment. Number 9, the patient is entitled to all relevant information regarding policies and regulation of the health facilities that he or she attends. All right, so whichever policy the hospital have gotten, the pharmacy has gotten, is the patient right to know. Number 10, procedures for complaints, disputes, and conflict resolution shall be explained to the patient or their accredited representatives. So normally we don't see this thing in most of our hospitals, by the way. If the way the doctor handled you, the way a nurse handled you, the way the pharmacy handled you, the way the records department handled you, if you are not happy, if there's a misunderstanding and disagreement, the hospital should have a procedure that the patient can launch a complaint, okay, where the issue can be addressed. The patient should not walk from the hospital annoyed because of the way he or she was treated. Number 11, hospital charges, mode of payment, and all forms of anticipated expenditure shall be explained to the patient before treatment is done. Now, when the patient walks into your pharmacy and the patient wants to do, let's say, diabetes test to test their blood sugar, we don't just run the lab without taking the patient through how much he or she will be paying. All right. So normally before a doctor does any procedure, unless of course an emergency, but when the patient comes to our pharmacy and is requesting any procedure, we tell them of the cost before. If they are okay with the cost and they understand everything before we start treatment. Number 12, exemption facilities, if any, shall be made known to the patient. If there's any facility on or in the health service where the patients are supposed to pay more or the patient cannot access, the patient should be able to know. There are some wards that are called executive wards and private wards. There are areas that a patient cannot enter because of security issues. We should explain to them so that they understand we are not discriminating among them. The patient is entitled to personal safety and reasonable security of property within the confines of the health institution. So anytime a patient comes to our pharmacy, the patient is under the protection of the pharmacy. We protect them. Here, within what we can do, that's why it's a reasonable security. All right. So assuming a patient is in a hospital and their luggage is stolen, whatever it is, okay, the responsibility will fall on the health facility the patient visited. Number 14, the patient has the right to a second medical opinion if he or she so wishes, and this is so important. If a patient or any of us goes to a hospital and a doctor makes a diagnosis that you have a particular disease and the treatment is huge decision, for example cancer, or they said you have to do a surgery, normally the patient has gotten the right of a second medical opinion to go to another hospital to see and confirm that whether what they are seeing is the same thing. Sometimes there could be mistakes from the scans or the labs that have been done. All right, so the patient has gotten the right of a second medical opinion. If a patient comes to my pharmacy and I do a lab test and I see the patient has gotten malaria, the patient can say that, okay, do you know what? I want to go to the hospital and confirm. Okay, I want to try another method and confirm to see if I have malaria indeed. And that is the right of the patient. I shouldn't be annoyed that the patient doesn't trust me or the patient is doubting me. No, the patient has gotten the right of a second medical opinion if he or she so desires. Okay, so basically that's the rights. Let's look at the responsibilities. The patient should also understand that he or she is responsible for his or her own health and should therefore cooperate fully with healthcare providers. The patient is the best person to tell us what is wrong with them. If the patient lies, there's nothing that we can do for them. So the patient is responsible for one, providing full and accurate medical history for his or her diagnosis, treatment, counseling, and rehabilitation purposes. Okay, the patient comes to the hospital and lies to the doctor, doesn't give them the full information. You have a condition, you don't tell them the truth. You've done surgery before, you say you've not done surgery before. You drink alcohol, you say no, you have never taken alcohol before. You have a boyfriend or a girlfriend or you are sexually active and you come and say you are a virgin, and let's say you have gonorrhea, the doctor will never suspect it's gonorrhea because you've told the doctor that you've never had sexual intercourse before. All right, so the patient should give full and accurate medical history so for his treatment, diagnosis, counseling, and for rehabilitation purposes. Number two, the patient should request additional information from the healthcare provider or clarification regarding his or her health or treatment which may not have been understood. And this is very important. Sometimes the patient walks into the hospital and the doctor says that, Madam, after a lab, it shows you have gastritis. Now, a lot of patients will say, oh, doctor, okay, I see. So, what? Oh, I'll give you some medicines. Now, when the patient comes from the doctor's consulting room, they'll still be wondering, what is even gastritis? The doctor say, I have gastritis. Then they'll start to cry, oh, then I'm dead. It's gastritis. I'm dead. I'm dead. I'm dead. God, what is this? They never ask the doctor, doctor, please, what is the gastritis? And by the way, gastritis is just inflammation of the stomach. The stomach is gastric. Itis means inflammation, okay? You assume the doctor say you have gotten gastritis. It means you have an inflammation in your stomach. You have some things going on. That's what causes a lot of pain, all right? You have a lot of pain in the stomach. So what you say that is, if whatever the doctor or a pharmacist or any healthcare professional says, if they use their jargons and anything you are not clear, is their right and their responsibility to ask. The patient does not ask questions. The doctor is not at fault. The patient should also comply with prescribed treatment, reporting adverse effects, and adhering to follow-up requests. Whatever, if the doctor tells you to take 2 tablets of paracetamol, the patient should take 2 tablets, not less, not more. After taking the tablet, if we are reacting, if something is happening to you, you have rashes, you are bleeding, you can't breathe, you can't sleep, you are vomiting, you are supposed to let the doctor know that after taking the medicine, this is what the medicine did to me. And also, if the doctor have asked the patient to come up for follow-up request, which I know a lot of us are guilty, we are supposed to go back again in 3 days, in 4 days' time, in a week's time, in 2 months' time, in 3 months' time, in a year's time, so that they review to see whether what they wanted, the treatment outcomes, what they thought the disease would do to you. Is it going the same way? Is it being managed well or not? Most of us don't go for follow-up requests. And if you're like that, please let's learn from the patient responsibility. Number 4 is the patient's responsibility to inform his or healthcare providers of any anticipated problems in following treatment or advice. Now, if a doctor asks a patient that take the medicine with food, the doctor knows why he's saying that. A lot of medicines, when you take it, it will reduce your blood sugar and you can go unconscious. Okay, so if the patient is having a problem, maybe the patient is in a 21-day fasting, 10 days fasting, and they are promised to God that I'll never eat, and the doctor have asked you to take a medicine with food. Tell the doctor, doctor, please, I am doing a fasting and I don't want to break it. So is there anything you can do about it? Because I will not be able to eat. That's an anticipated problem. All right. The patient should not be quiet. If the doctor gives you a medicine you have taken before and you took the medicine and you nearly died, tell the doctor, no, doc, this medicine I took it before and it nearly killed me. So can you please change it before? See, the patient plays an important and vital role in ensuring that they are well. Okay. Number 5, it's also the patient's responsibility of obtaining all necessary information which may have a bearing on his or her management and treatment, including all financial implications. All right. So when the patient comes to our pharmacy, they can ask questions. How will my disease be managed? How will it be treated? What are the side effects of the medicine? How much is it? How long am I going to take it? Okay, is there a cheaper type of the medicine you want to sell to me? It is the patient responsibility to do all those enquiries. Number 6 is the patient responsibility of acquiring knowledge on preventive, promotive, and simple curative practices, and where necessary to seeking early professional help. Okay, is the patient, normally I've said this and let me say it here again. You see, a lot of hospitals and pharmacies we have, if a patient walks into the consulting room and they leave, the doctor forgets about you and calls the next patient. It's the patient's responsibility to acquire knowledge. If I have asthma, if I have diabetes, if I have hypertension, if I'm an ulcer patient, if I have arthritis, if I have any disease at all, it is my responsibility to acquire knowledge about how to prevent or how to treat my disease. So that when I go to the consulting room, I can now judge with the doctor. I can tell the doctor, doctor, I've heard that asthmatic people are not supposed to take aspirin. I read it somewhere. How far is it true? Oh, doctor, I've heard that patients that are having arthritis, okay, inflammation of their joints, pain at their joint, if they are able to do exercise and take some type of food, they will be well. You see, anytime that a patient have gotten a condition, the more they read about it, the better that they get what we call professional help. Number 7, the patient responsibility of maintaining safe and hygienic environment in order to promote good health. Most of us live in areas that there are a lot of mosquitoes, and we are not sleeping in insecticide treated nets. As the rains have started, okay, there are mosquitoes everywhere. Look at the community the children are playing, and I'm sure this gutter will be smelling like something. Okay, and this will make them sick. It's the patient responsibility to clean their gutters. It's the patient responsibility to sleep under insecticide treated nets, what popular people call mosquito nets. It's the patient responsibility to wash their hands before eating. It's the patient responsibility to ensure that they live a healthy lifestyle. They exercise, they eat fruits and vegetables, they drink a lot of water, they have adequate rest. It is their responsibility. All right. Number 8 is a patient responsibility to respect the rights of other patients and clients and healthcare personnel. There are patients that don't respect anybody when they come to the hospital or the pharmacy. They don't even respect the pharmacist or the MC. They will call the MCA names. It's not to their advantage. All right. So it's the patient responsibility to respect other people, including the healthcare personnel. Sometimes they go to the hospital and some will fake as if their disease is serious and they'll be crying, oh God, help me. Oh, I'm dying. Somebody help me. Somebody help me. And they are faking it because there's a long queue. They want to be given attention. That is not fair. So it's their patient responsibility to respect the rights of other patients, to know that they are all human beings. We are all the same. We are not better than any other person. So we have to wait till their turn before. And the last one that you talk about is their patient responsibility of protecting the property of the health facility. Sometimes I see mothers bring their child, they leave the child is playing, and you end up destroying the blood pressure machine or the health facility instruments like that. No, you control them. Okay, they have to protect it so that it can be used for a lot of people. Thank you very much. And this is the end of our lecture on the patient rights. And as I've said, healthcare is a human right. Universal access to healthcare without discrimination is a human right. Please, when you start working in the pharmacy, practice these things we are learning. I'm begging you. Let's respect the patient. Let's know they have a right. If the patient is asking questions about the medicines, let's support them. Let's encourage the patient. Encourage them. Ask them, Madam, please, is there any question you want to ask about your medicines? Is there anything the doctor said that you don't understand? Will you want other help? Sometimes we even give the telephone number of our pharmacy to them. If you go home and there's anything that is bothering you, or there's something that you remembered that you should have asked that you didn't ask, please don't worry and call us, because health care is a basic human right. Thank you very much. I have only one question for you today, and that is, how will you apply the patient charter to enhance your role as a medicine counter assistant? Okay, I don't know what you want to do with it. Is there anything peculiar? For example, for me, when I'm working as a pharmacist, I encourage patients, I promote them, I want to develop health guidelines for them. Okay, and with this mindset, I don't see the patient as a burden. I see the patient as a blessing when they come to the pharmacy. God bless us all. And this is the end of section B. From Monday, we'll start a new lecture on section C, and that's the health service environment. Thank you, and send your assignments to my email, markbequin4@yahoo.com. Thank you very much. God bless you.